happy to be talking with you today about the use of the Policy Readiness Tool in public health. We have some wonderful advisors that we will be introducing today. This is just a reminder that if you have joined today's webinar by teleconference, we will need you to mute your speakers. We do not have the ability via our webinar platform to go into lecture mode to automatically mute everybody else on the line besides the presenters. So please take this opportunity to find the best way to mute your line. If you're having any feedback from the presenters during this time, you can get rid of the feedback by going up to Communicate and then going to Broadcast and then click on Mute Speakers. So again, just some housekeeping items. Thank you again for joining us today. There were two ways in which you could join us by audio, and one of the ways was just through WebEx itself. And if you have any issues with the audio, please make sure to communicate. Make sure your speakers are on.
Yeah.
And the other way to join is via teleconference line. For those of you joining us via teleconference line, it's very important that you mute the speakers from the line from which you've joined. And then also, as many of you may have just heard, there was some feedback on the line. So to eliminate the feedback, you need to go to Communicate, Broadcast, and then Mute speakers if you've joined us via teleconference. We'll continue to post these messages in the chat box during the webinar as a reminder for all of our participants today. So just a bit more housekeeping before we go ahead and get started. Please go ahead and use the Q&A to post comments and questions during the webinar and send the questions to all, not just the host privately. We will have an opportunity for question and answers at the end of the webinar. And if you have joined just via WebEx, you can type your questions into the Q&A and we will ask them of the presenters. And if you've joined via teleconference, there'll be an opportunity for you to ask your questions in real time. So we are going to take a moment to ask you and get a good sense of where everybody is from here that is joining us today. So we will be publishing the results of all of our polling questions at the end of the question when we've gotten all the data. But just to let you know, as we go through, it seems that we have some participants from Ontario, from Nova Scotia, from Alberta, from New Brunswick joining us today. So please take a moment on the right-hand side to indicate where you are from. So we'll just wait another moment or so as some other people, to give everyone a chance to respond. We're also seeing some participants from British Columbia, from Quebec, continuing to have participants from Alberta and Ontario, Nova Scotia. All right, so we will go ahead and move on, and you will see the results. Everyone will see the results for those who have joined us so far. So those will show up in a moment. But we have just less than half, about 40% of participants from Ontario, and then Nova Scotia and Alberta, and followed by British Columbia, Quebec, and New Brunswick. Okay. So I is very excited today to welcome you to our webinar series called the Spotlight on Methods and Tools. My name is Jennifer Yost, and I am a knowledge broker at NCCMT, or the National Collaborating Center for Methods and Tools. So today is our 19th episode in our and we are going to be focusing on the use of the Policy Readiness Tool in public health. Previously, about 2 weeks ago on September 17th, we had our first webinar in which our presenters provided a longer overview, a very in-depth overview of the Policy Readiness Tool. So today, very excited because you're you get to hear some real user stories about how the tool has been used in public health. If you would like to, you can access the, you'll be able to access the summary statement from NCCMT on our website there, and the website is listed. So for those of you who may not be familiar with NCCMT, we are one of 6 national collaborating centers funded by the Public Health Agency of Canada. We are located here at McMaster University in Hamilton, Ontario. While 4 of the NCCs support the use of research evidence in a specific public health content area, NCCMT and NCC Healthy Public Policy work across content areas. And so at NCCMT, we focus on improving access to and the use of methods and tools that support moving research evidence into decisions related to public health practice, policy, and programs in Canada. So among the products and services we have available at NCCMT, one of them of which we're working with you today on is our webinars. We also have other products and services to help move evidence into practice. So we have a learning center which houses a suite of online learning modules. We also have a new Using Research Evidence video series on our website. And in a moment, we will post a link to those in the chat section so that if you would like to check them out, you'll be able to do so. So we actually now would just like to get a sense of what sector in public health that you are from. So we'll give everyone a moment to go ahead and respond to this question. And we see, so far we have some public health practitioners joining us today, some attendees working in provincial, territorial government or ministry, research, policy analysts, other health practitioners besides those who work in public health. And yeah, so we'll give everyone a few more moments to go ahead and respond to the question. And I can definitely, as hopefully we'll be able to publish the results. You'll see those in a few moments. But primarily we have those who are public health practitioners joining us today. So we'll move on to the next slide, which is slide number 7. And it's my pleasure to welcome Dr. Candice, who is an associate professor in the School of Public Health at the University of Alberta and the Canadian Institute of Public Health, the Public Health Agency of Canada, and Alberta Innovative Health Services Applied Public Health Chair. So Candice will be providing us a brief overview of the Policy Readiness Tool, and then she will also be introducing us to our user stories as we move along in today's webinar. So it is my pleasure to welcome Candice here today, and I'm going to pass the baton over and turn the webinar over to her now.
Okay, hello everyone. I apologize in advance for the quality of the sound. It's not your phone, it's my voice. But thankfully, I'm only chatting with you for a few moments, and then I'll be turning it over to my esteemed colleagues who will be sharing with you their experiences using the Policy Readiness Tool. Before I begin, excuse me, into the overview, I did want to just remind everyone that the purpose of today's call is really to give you more of a hands-on feel for how people have applied the tool and what worked for them, maybe what didn't. So as you're listening to the panelists speak about their experiences, I really encourage you to store up your questions for the end of this session to really be able to pick their brains about their experiences. So moving on, I'd just like to ask you one more.
Just don't forget, please, that I had a ward appointment.
Sorry, Jennifer, you're not on mute.
Yep, so that actually was not me. Just a reminder to all of the attendees that have joined via the teleconference today, we just posted another message in the chat. Please mute the telephone from which you have joined the teleconference because, as we've all just seen, the background noise can be a bit distracting for our presenters.
Thank you. Sorry, Jennifer, for saying. Okay, so we just have one more poll question before we get started, and I'd like if you guys could indicate those ways in which policy is part of your work or setting, and this will help give our panelists a bit of context from where you're coming from. So you'll see the options on the screen and on the side. Pick the one that's closest to your role, please. And Jennifer, I'll rely on you to just let us know how it's going.
Yeah, so we've had a number of people respond, and we have, I would say most people are responding that they participate in policy advocacy formally or informally, and they contribute to policy development, as well as I help to find evidence and build the case for new policies. Most people are responding, and again, people can choose more than one option. The only one that I'm not seeing being answered at the moment is number 7, that policy is not part of my work or applicable to my setting. So I think that's a good sign that we've got the right people on the phone today.
Excellent. Okay, so in the spirit of time, let's just keep moving along then, because I think we have a good sense of who we all are on the phone today. So I want to start by showing you, when you look to find the Policy Readiness Tool online, this is what our new homepage looks like. And you'll see that on the side, you can access the tool itself and explore what it's all about. You can actually apply the tool in the situation or context that you're working on and get linked to or evidence-based strategies linked to your organizations or settings readiness for change. Or you can join our online community, which is brand new and where we're hoping to create a bit of a community of practice where we can all engage in real conversations about how to support policy development and implementation for our issues and our settings. So moving on, I just today would like to provide a quick overview of the tool itself, and this is for the benefit of those of you who weren't able to join us for part 1. This will help orient you a bit to what we're going to talk about today. And as Jennifer mentioned, you're always welcome to go back and listen to the recording of the previous webinar if you're looking for more detail, or you're welcome to contact me, and I am happy to have a conversation with you about it. So the Policy Readiness Tool is an evidence-based tool that helps foster the development of healthy public policy. And really the intent of this tool is to make participating in the policy process more friendly and easier for both experts and non-experts alike. I find that it can be quite intimidating for non-experts or those new to the area, and even if you are a seasoned professional working in policy, it can become intimidating to switch from issue to issue or jurisdiction to jurisdiction. And the policy tool, while it's not a one-stop solution, it is meant to help ease some of those fears. And my slides just disappeared. So Jennifer, can you please click to the next slide?
Yes, I can. It will just take us a moment just to turn the time back over to ourselves here, and I will advance the slide for you.
Okay, because ours just completely disappeared off the screen.
Okay, so I believe I've advanced the slide to the next one.
Okay. So just give me 1 second. I'm going to just try to sign in one more time. Okay, so as we're continuing, so what is the Policy Readiness Tool? Basically, it's a very simple self-administered checklist that allows you to assess readiness for policy change relative to the situation that your community is in. And it consists of 11 questions that you go through to, sorry, I'm just clicking. We're trying to re-sign in as we go. It allows you to, sorry, okay, we're up. So given that the policy process is dynamic and can be intimidating, the tool offers a place to start. And that's where we left off before my slides disappeared. So if we could just move on to the next slide. Perfect. So the tool itself is a simple self-administered tool that allows us to assess policy change readiness very quickly. It's 11 questions that help target, then the responses help target to evidence-based strategies for taking action, and also recommends general evidence-based resources to foster that healthy public policy. When we're talking about readiness for policy change, it's really important to point out that readiness is not a static concept. It's not something that you assess once and then that categorization sticks in perpetuity. It describes a relative tolerance for risk around a new policy or a new policy issue or a new policy solution. And that can change from issue to issue, from time to time, or from setting to setting. So it's really important to keep in mind that even if you're working within a single setting, it might be useful to you to assess readiness at more than one point in time. And next slide, please. Oh, we got it. So there's 3 general readiness categories that are used in the Policy Readiness Tool. Those that come out as mostly A's are described as innovators. Innovators are described as generally adventurous, and they often serve as initiators or role models within their social network. So they are the first to adopt a policy or suggest a policy solution, and they're often the first to then also evaluate the impact of those solutions. Mostly B's, or the majority, are described as deliberate, and that's because this group usually requires time to consider the evidence, the pros and cons around developing a new policy. And this is really where policy evaluation comes to play, because these are the adopters who really want to know what has worked in terms of itself, what hasn't, but also what are the intended and unintended impacts of the policy. They would like to know that before adopting. And then the third group, the C's, or late adopters, are described as traditional. These are often adopt later in the process, and they may be skeptical of new policies and new ideas to solving policy problems unless there's substantial evidence on the table. They also may be eager to maintain the status quo. And if you want more information on any of these categories, again, I encourage you to hear out the previous webinar or check out the tool online or contact myself for more information. So the readiness categories, when we're thinking about them, I just really find that it's important to remind everyone that readiness is not a value judgment about a community or about an organization. There is no good or bad adopter category, even though intuitively it may seem that it's better to be first and worse to be last. That's actually not the case. So to draw on the example of innovators, while innovation in a policy arena may seem to be leadership, it can also be seen to be very risky, because these folks are adopting policies without really knowing what the impact or outcome of those policies may be. And they may be spectacular successes, but they may also not be. So it's important, and in a contrary example, later adopters, while they may come late to the table, which could be seen as a negative, they also often come to the table with every evidence in hand and tend to adopt the gold standards that have been developed and established by others before them. So they ultimately end up with a much stronger policy solution without having to go back and forth to the policy development table. So it really is fair to say that each category, whether you're innovator, majority, or late adopter, are equal in value. They all have strengths and weaknesses, and it's important to recognize that when you are using the tool. So I'm just going to stop there and now turn the call over to Shandy Reid, and I'd like to just take a moment to introduce Shandy. Shandy has a background in social work and an MSc in health promotion studies. She, and I know this firsthand, is a passionate advocate for tackling public health issues using comprehensive approaches. She has co-led the development and implementation of several strategies in the areas of addiction, tobacco reduction, early childhood development, as well as in actions to influence healthy public policy at the federal and provincial government levels and in the NGO sector. Shandy is a member of the Wellness Alberta campaign team, which is an initiative targeting meaningful government investment in disease prevention and health promotion in Alberta. And Candice currently works with the Alberta School Employee Benefit Plan, which is focused on partnership development and workplace health promotion in the education sector. Oh my goodness. Shandy, I've turned it over to you.
Thank you, Candice. Good morning, everyone. Today I'm actually going to talk mostly about my experiences using the tool when I was working with the Alberta Policy Coalition for Chronic Disease Prevention, which was just a few years ago now, also referred to as the APCCP, and you'll be hearing more about that organization in a few minutes. But today, let's start by talking about a few years ago, which would be 2011, when the City of Leduc, which is a community in Alberta, that took a bold step to pass a bylaw at that time to ban smoking in vehicles when minors were present. And so as a coalition, we've been involved in a variety of different ways during that process by presenting to council, sharing evidence to support this action, sharing the results of some surveys we'd done with the public and decision makers about the kinds of support that there was currently in the province for this intervention. So we knew that, securing a groundswell of municipal bylaw could lead to a tipping point that might eventually lead to a provincial legislation, and that was really our end goal. We ultimately wanted a province-wide ban in this issue, and we're looking to spur on others. So this provided a perfect example in our own province to test out the Policy Readiness Tool, a community that I was also very personally familiar with. Next slide, please. So Candice and I, at the time we were working closely together with the Policy Coalition, we decided to submit a letter to the editor in a paper that was within a municipality that shares very similar characteristics to Leduc. Now, Leduc, just for your reference, if you're not from the province, is a smaller community that surrounds the city of Edmonton. So the municipality that we submitted the letter to is called Strathcona County, and it also is a boundary city or community to the east of the city of Edmonton. And this has been my own home community for almost 10 or 12 years now. So Strathcona County, as an observer, as a citizen in that community, I noted has a really strong history, which is also very proud of being quite progressive. It actually was one of the first communities to pass a non-smoking bylaw in Alberta, and was the first community to pass the distracted driving or hands-free cell phone use bylaw in Alberta. They've also done some really exciting work in the past around social sustainability and has some great policies there in case you're interested. Oh, sorry, you've got one slide too far. Thank you. You can just go back to one that says the initial letter. Based on my own observations and experiences then as a resident in Strathcona County, I completed the Policy Readiness Tool. So I used my own observations, my experiences that I've had interacting with members of the community and with those who work in that area to complete the assessment. And as I expected, they were mostly A's, so within that innovator category. This made me wonder at that point, it's pointing out that at this time they weren't actually the ones to lead the pack, because Leduc had already got out ahead of them, that we might be able to get a reaction from them or hopefully speed up their own consideration of the issue. So what you're seeing on the screen here is the letter, and if you look down to paragraph 2, you'll see that there's several references to their own reputation as leaders and the note about Leduc doing it first. So there was the bait. Okay, next slide, please. So what you can see is we've got a copy of the letter here, and I guess the question is, do you think that message had an impact? We felt as if the framing of our letter did seem to resonate or did get the attention of constituents, and at a very least, the editor of their local paper. So, of course, now I want to qualify that writing letters is just but one possible strategy for any given issue, and you'd see that when you look at the strategies contained within the Policy Readiness Tool. But it did prove an excellent opportunity for integrating the assessment that I did from the PRT. Ideally, the PRT would inform the development of a comprehensive and a multi-pronged process development strategy. And of course, those of you who work in this area would know that would include government relations, communication, and stakeholder mobilization. And ultimately, in this case, the issue of smoke-free cars, the province did step in and committed to provincial legislation on this issue, which has now been passed since in our province. But I think what's incredibly valuable in this experience is to also although this is a small example, it did show to me as a practitioner the importance of conserving the resources. And this sort of tells us that if there is the opportunity to create a tipping point with municipal bylaws, as a practitioner who rarely has a huge amount of resources and funding, I mean, advocacy is a hard area to work in, and as far as having stable funding to support you. But if you're able to get different municipalities on board and create that tipping point, then the opportunity for you to sort of focus your efforts on the innovator group, those who will move along others or create some pressure and get that groundswell, is really a great place to focus those limited resources and put a bit more effort in. So, rather than trying to do a blanket approach and work with all municipalities at the exact same time with the exact same approach, I've done that in the past before I was perhaps more experienced and a bit more astute. And it turned out to be quite a rather large of resources, both of my time, incredibly frustrating also, and really because I hadn't been paying enough attention to the state of readiness within the communities that we would have to work with. So there's been some lessons for me, both then at that time and it's been invaluable. Next slide. I just want to draw attention that Candice did mention that, of course, community readiness for a policy isn't static, so it can change from issue to issue. In this case, we were hoping that because the issues we were testing out by using the PRT fell more broadly within public health, more generally, that the state of readiness might be more stable. And in fact, we found that it was in this case. But you'll see even from this slide that the verbiage then, the conversation we started around trying to keep up with other municipalities continued on and translated into the issue of recycling as well. So this had a further impact than we even initially had anticipated. Next slide, please. So where are we now with the PRT? Well, I now work with an organization called the Alberta School Employee Benefit Plan. And it's a benefits provider for the K-12 Alberta education sector. And in our own organization over the last few years, we've been making a rather significant shift towards health promotion and disease prevention in a meaningful way. And for some, this isn't a small shift. It's moving and expanding some of the ways that we've been thinking about health in our own plan. And we did understand that the importance of it was very important for us to make sure that our own staff internally and all of our stakeholders were engaged and understood the shift on a philosophical basis as we move forward in this journey. So about a year or so ago, we actually asked Candice and her team to come in and present to a leadership team and others who work in this area and present on the Policy Readiness Tool. And this led us to identify a real opportunity for us to use the tool when we were assessing our own internal readiness to move more intensely into this work, into this more health promotion field. And we're going to continue to use it, but for us, even just the process of working through that conceptually within an organizational perspective was invaluable. And now, based on that positive experience, and we just never seemed to find an end in sight for all the different ways we could use this tool, we're currently working with Candice and her research team to adapt the tool for ideas in a new setting. So we currently in my organization, I'm very fortunate to work with a team of health advisors who work with Alberta school jurisdictions to help them develop, implement, and evaluate employee and workplace wellness initiatives in their school districts for school employees. And so, as one could expect across the whole province, the state of readiness for this work is mixed. There's some jurisdictions that are very far down the road, have been doing amazing things for many, many years. And there are other districts who are just becoming very interested in this or starting to assess whether or not they're ready to take on this journey. And so we really felt as if we could adapt the team or the tool with the research team to the idea of idea readiness and being able to use the tool to assess a district's readiness for the idea of school, employee, or workplace wellness and taking on that area of work, that would again be incredibly helpful when we're talking about conserving resources and channeling energy into the right areas, and would support our health advisors as well as they work with those school jurisdictions to help them design strategies. So right now we're working with the research team to both adapt the tool as well as relevant the strategies that would be specifically applicable within a school as a workplace setting. And we hope to have that work completed and do some workshops on it in the new year. So very excited. I never seem to have any shortage of ideas for this amazing tool. So thanks for letting me share my experience.
Okay. Next slide, please. Next, I'd like to introduce Cathy Gladwin. Cathy is the policy analyst at the Injury Prevention Center in the School of Public Health here at the University of Alberta, and she has been working there for over 15 years in a wide range of policies related to injury prevention. Cathy earned her MSc in Health Promotion, specializing in public policy, and much of her time is spent researching and advocating injury prevention policies. And I know that from personal experience, Cathy is just a tireless advocate and works at all levels of public health. So I'm going to turn it over to Cathy.
Thanks, Candice. So at the Injury Prevention Center, one injury issue we were working on was trying to reduce the number of ATV injuries, all-terrain vehicle injuries, or quad injuries that were happening in Alberta. So the problem we were facing is that Alberta is the only jurisdiction in Canada that didn't have any legislation around wearing helmets. And that was because, you know, our provincial government hadn't put it in place, and they also weren't interested in moving towards other ATV safety measures in law either. So when I heard about the work that Candice had done and the case of the tobacco laws at the provincial level, coming only after tobacco bylaws were put in place in many municipalities, I started looking at the ATV bylaws and that municipalities had in place. Next slide, please. In Alberta, there are a number of different kinds of municipalities. There are urban municipalities, which are cities, towns, villages, summer villages. But these are not the primary sites for ATV use, so we focused on the other types, which are municipal districts, and of which some are called counties, and specialized municipalities, which allow for urban and rural communities to coexist in a single municipal government. In 2013, I conducted a review of ATV municipal bylaws. So I listed the 69 municipal districts, counties, and specialized municipalities, and I searched their websites for bylaws relating to all-terrain vehicle or off-highway vehicle use. Jurisdictions which did not have their bylaws posted online on their website, I contacted by email, and they provided me with any bylaws relating to ATV use that they had, if they had any. In particular, I was looking for bylaws that would impact the safety of ATV riders. Next slide, please. So according to the evidence that we find in the injury prevention literature, our Alberta, we had formed an Alberta ATV working group, and so the working group determined that the most effective safety measures that we would promote were the use of a helmet, prohibiting riders under 16 years of age from riding the large adult-sized ATVs, restricting passengers on ATVs to what is recommended by the manufacturer, speed limits, riding only in daylight hours, and seeing that operators received education in the use of an ATV before they were riding. Alcohol and drugs actually are huge problems in you know, causing or being factors in many ATV incidents, and but since the alcohol and drug laws that regulate cars, you know, in the driving of cars are in the criminal code, and that actually covers this, although covers ATV use, although people aren't really aware of it. We didn't have to worry about that, but we did include it in some of our promotional material. So there were 28 of 69 municipalities were found to have bylaws relating to ATV use. So, and of these, the County of Parkland was found to have the most comprehensive bylaw, which addressed 5 of the 6 protective elements. Parkland requires ATV users and riders and passengers to wear helmets. It restricts the number of passengers to the number recommended by the ATV manufacturers. They have some speed limits and restricts use of ATVs to the summer daytime hours. The one key element that was not mandated in Parkland was educating ATV operators in the safe use techniques, but no other municipality had this element in their bylaw either. We found that 4 municipalities had 4 of the 6 elements, and these were the County of Beaver, Leduc, Thorhild, and Wetaskiwin. In total, 8 municipalities mandated helmets, and 10 had, in their bylaw, they limited the number of passengers to that recommended by the manufacturer. So 8 municipalities only had speed limit and the daylight hour restrictions, and while these were helpful in reducing injuries, we really felt that those weren't put in place so much for safety as they were to stop the nuisance that the noise of the ATV riders cause the residents. And often this part of the bylaw only applied to hamlets or residential subdivisions within the municipality. Now we're ready for the next slide. So rather than assessing the policy readiness of the remaining municipalities, I decided to look to label the municipalities that had 4 or more safety elements in their bylaws as innovators. I did find a number of similarities among the counties that had better ATV safety bylaws. The best of them were clustered around Edmonton, some sharing our boundaries. All of the others are in the northern half of Alberta. Most of them had a large city or town within their boundaries, which would have been an agricultural hub for the municipality. And most of them are recognized as designated ATV recreational areas. So then, next slide, please. So then I conducted a number of informal interviews with individuals from the municipalities to find out about the development, implementation, and the implementation of their bylaws. And I found that all of them actually held the belief that the municipality has a duty to protect its citizens and that policy is an effective way of doing that. That the municipalities are willing to make the decisions based on broad knowledge of the evidence without demanding anything specific or without demanding localized data. And they are not worried about their ability to enforce all the aspects, but they hold the belief that the very existence of a bylaw will help in changing the behaviors of their citizens. Next, please. So rather than look at the bylaws relating to other issues that a municipality had, I focused on what I could find out about the ATV issue in the individual communities. So for municipalities that had less protective ATV bylaws, I noticed some similarities as well, where they had fewer bylaws overall. So they didn't have, their list of bylaws was small. They didn't implement a lot. They just relied on what the provincial laws were. They had a narrower scope of services for their citizens, and they were not a recognized destination for recreational ATV use, and they were more distant from Edmonton. So in 2014, the Injury Prevention Center focused its ATV safety awareness activities on the theme of what municipal bylaws could, of which municipal bylaws existed and what municipalities could do to improve the ATV safeties within their boundaries. So we created, published, and then gained earned media coverage of what the County of Parkland was doing. And we worked with the county on a media event to highlight their bylaws and their enforcement activities. And our aim in this was to congratulate Parkland and raise awareness and interest in the other municipalities so that they might implement similar bylaws, and so that their residents or other concerned citizens in other municipalities might ask their municipality to do the same thing. Then, with the election of the NDP government in Alberta in May of 2015, the Injury Prevention Center has refocused its efforts on getting provincial legislation for ATV safety. So for the rest of this year, we will not be moving forward on promoting uptake of the municipal bylaws, hoping that the province will take it on. But if we don't get a full set of safety elements in the provincial legislation, we will return to our plan for 2016. One problem we have is getting ATV injury and death data that we need to support what's happening in a municipality. The provincial surveillance system just isn't set up to collect data specifically on ATV incidents, and linking it to specific municipalities is very hard. Therefore, it is hard to make a case at the individual municipality level where they will be able to see the impact that their bylaw has on the injury issue. So that's one of our barriers in advocacy. And also, we do not have sufficient resources at the IPC to do lots of on-the-ground advocacy with individual decision makers in the municipalities. So the strategies that we will work on, if we need to go back to working on the municipality level, are this might be the next slide. Are to create a set of model ATV bylaws, to highlight the bylaws being implemented in neighboring communities. So come on, guys, the Keep Up with the Joneses issue, persuasive tactics, to frame the message on how the broader region will gain from having the same bylaws. We'll work at fostering conversations between champions in one municipality with people in neighboring municipalities. We will work to promote the safety bylaws through the Alberta Association of Municipal Districts and County events and communication channels to reach municipalities that are further out in the province. So the ones that we don't have the resources to go out and talk to individually will rely on the association to be the channel. And we will continue to raise public awareness of the need for the safety behaviors that can protect ATV users. That's all for me.
Okay, thank you so much, Cathy. And next I'd like to introduce Sherry Jarvis. Sherry is at a distance from us here in this room, so I'd like to just let you know that she's a research project coordinator at the Applied Research Collaborations for Health in Dalhousie University. Sherry has worked in the health promotion field for many years and graduated from Dalhousie University with concurrent degrees in health promotion and sociology. and most recently she completed her Master's in Adult Education at Mount St. Vincent University. And Sherry, turning it over to you.
Great, thank you. Hi everyone, thank you for this opportunity to discuss the research project that I'm currently working on. It's called Healthy Eating in Recreation and Sports Settings, and we call it HERS for short. And I'd also like to discuss how we use the Policy Readiness Tool to help us recruit participants for our study. But first, let me give you some context for this research project. The Nova Scotia Department of Health and Wellness recently launched voluntary healthy eating guidelines to help increase healthy food options in recreation and sports settings, because research has shown that although these settings promote physical activity, they often offer unhealthy foods. And this became very obvious to us during phase 1 of this project when we gathered baseline data prior to the release of the voluntary guidelines. My slides don't seem to be, oh, there we go. So we are now entering phase 2 of the HERS research study. And the objectives for this study, they're listed here. So understand the structures and processes required to optimize healthy eating guidelines implementation in recreation and sports settings, and to describe changes to food environments as a result of the uptake and implementation of healthy eating guidelines, and to define the level of implementation that is required to produce desired outcomes in the food environment. So right now, we're working on Objective 1, and in order to do that, we are going to collect data from facilities to help us understand the barriers and facilitators of guideline implementation, as well as how these barriers and facilitators may be worsened or moderated depending on a facility's readiness for change. So for example, we're interested to see if late adopters experience similar barriers to implementing the voluntary guidelines, and if they need similar supports to overcome these barriers. So we plan to collect this data, this information, by conducting case studies, which will include stakeholder interviews, observations, and documented reviews. So we use the Policy Readiness Questionnaire to help us recruit case study participants. So several months ago, we distributed the survey to recreation and sport stakeholders across Nova Scotia, and based on their responses, they were grouped into either innovators, majority, or late adopter categories. And so this survey had 2 sections. So there was an introductory section where we asked questions about the type of facility and the location, that sort of thing. And then we included the Policy Readiness Questionnaire. And in the survey overview that we included with the informed consent for this survey, we stressed that there were no right or wrong answers to the questions or good or bad categories, which have been already discussed. And so the results from the survey, we got 15 surveys completed, and from those we got 7 innovators, 6 majority, and 2 late adopters. So you're probably not surprised by the fact that we got a low response from the late adopters. And we did follow up to the survey. So introductory section of the survey, we asked if participants wanted to know the results of the survey, and if so, to include their name and contact information. So 9 of the survey participants wanted to know the results. So I provided them with an overview of the category that best represented their facility, and as well, at that time, we invited them to participate in our case study. So to date, after following up with the survey respondents, we have recruited facilities for the innovator category and the majority category, but I have not been able to recruit for the late adopters. So it's proving to be very difficult to recruit facilities for this category, even though I stress that this isn't, we're not judging you, or there's no right or wrong category. We're still having trouble recruiting for this category. So we found the Policy Readiness Tool was very useful for us to categorize facilities into the innovator or majority or late adopter categories, but a challenge for us right now is to fill the late adopter category. So, and hopefully we can find them soon because my first case study is this upcoming Monday. So, so yeah, that's my experience with using the Policy Readiness Tool.
Thanks, Sherry. Yeah, if it makes you feel any better, we have the same experience with late adopters, and we could talk about that offline or during questions.
Yes, okay, for sure.
Okay, so next I'd like to, next slide, please. Well, while the next slide is loading, I just would like to introduce Kayla Atke. Kayla is the policy analyst for the Alberta Policy Coalition for Chronic Disease Prevention and the PowerUp class team, which are both located here at the University of Alberta. In this role as policy analyst, she helps to coordinate the activities of the coalition, as well as she gathers and reviews evidence to identify evidence-based policy interventions primarily for obesity prevention. Through her academic and professional experience, Kayla has developed a keen interest in the use of participatory approaches to promote healthy public policy change. And Kayla, over to you.
Thanks, Candice. And I had the opportunity to work with Candice and Shandy as a research assistant back when the Policy Readiness Tool was just being developed. So I've had a couple of opportunities since then to apply the tool. Next slide, please. There you go. So the Alberta Policy Coalition for Chronic Disease Prevention is co-led by Dr. Candice Nikiforuk and Dr. Kim Reid at the University of Alberta School of Public Health. And the coalition is a group of 17 organizations from across Alberta who have come together to coordinate efforts, generate evidence, and advocate for policies to reduce chronic disease risk in Alberta. And we focus on 4 key areas: unhealthy eating, physical inactivity, alcohol-related harm, and tobacco use. And we also aim to build capacity to use policy as a tool and to enhance public acceptance of policy-related activities. So, next slide. So today I'm going to talk about how we've applied the tool and are considering applying the Policy Readiness Tool to a variety of our projects. So first I'm going to provide an example of how we've applied the tool as part of a collaborative advocacy initiative, and then I'll discuss how we're planning to use the tool in an upcoming project to promote healthy food environments in Edmonton recreational facilities. And then last, I'll discuss the Policy Readiness Tool in relation to one of our projects called PowerUp. The first example illustrates how we've applied the Policy Readiness Tool within a collaborative advocacy project with Alberta Food Matters and the Growing Food Security in Alberta network at the provincial level. And Alberta Food Matters is one of our organizational members. From 2012 to 2013, the Alberta Policy Coalition supported Alberta Food Matters in moving through a collaborative advocacy process. And the result of this collaborative process was the beginning of a campaign calling on the government to develop a universal school food strategy at the provincial level in Alberta, which is one of our current priorities. The collaborative advocacy process was informed by Nixon's 7 steps in the development of a participatory advocacy initiative, along with several other advocacy resources. So because we were just at the beginning stages of the initiative, we focused on the first 4 steps of this process. So the first step is test the waters. So this really involves defining the specific problem to be addressed and exploring suitable solutions, as well as screening for community support and buy-in. The second step is defining the initiative. So taking a relevant initiative and forming it into a really clear policy objective. The third step is strategy and analysis. So this involves gathering information and developing strategy to build support for the proposed policy. And then the last step we focused on was direct issue organizing. So this really involves engaging in community mobilization and organizing to garner support for the proposed initiative. So activities here include letter writing campaigns, social media, media advocacy, and meeting with decision makers. So within the policy coalition, many of our activities take place at the provincial level, and advocacy at this level can be complex. So there's many different actors and moving parts, and multiple strategies and tools are needed. When I reflect on our work with Alberta Food Matters, the Policy Readiness Tool really provided a useful perspective at multiple points throughout our collaborative process in terms of thinking about how we wanted to position our advocacy campaign. Oh, we're just going to move back one slide.
Make it go.
Sorry. There we go. Great, thanks. So as I was saying, we found that the Policy Readiness Tool provided a useful perspective at multiple points throughout our collaborative process in terms of thinking about how we wanted to position our advocacy campaign. For example, thinking about the different adopter categories, innovator, majority type, and late adopter, and the PRT strategies for each adopter category were useful in exploring initial buy-in from different groups, forming our policy objective, and developing strategy to generate support for our campaign. I also think it's important to note that we use the Policy Readiness Tool as one kind of tool in our policy toolkit, and examples of other resources we use along with it include power mapping and stakeholder analysis. I also think it's important to note that when working on a provincial advocacy campaign, the PRT questionnaire and strategies could be applied at multiple points. For example, you might apply it to the provincial level generally, but you could also apply it to individual organizations, such as a school board in our case, when you're seeking buy-in to support the policy at the provincial level. The second example I wanted to highlight relates to our work in recreational facilities. This fall, we will be exploring the use of the Policy Readiness Tool to help build capacity to promote healthy food environments in recreational facilities through policy changes at the municipal level. So with this project, we're going to be using the tool in a variety of ways. First, we've been exploring how the tool can be used to develop policy resources, such as success stories, that are suitable to different levels of readiness. And looking at creating a bundle of tools that could apply whether your rec facility is an innovator, majority type, or late adopter. And then we're also exploring the possibility of using the tool to understand rec facilities' readiness for policy change, and then working with rec facilities to use the tool directly to promote healthy public policy within their rec facilities. Last, I wanted to highlight how the Policy Readiness Tool relates to a project the APCCP is partnering on called PowerUp. And PowerUp is funded by the Coalition's Linking Action and Science for Prevention initiative, and it is co-led by Dr. Candice and Dr. Kim Rain in the School of Public Health. And our PowerUp activities include summarizing evidence on the impact of obesity prevention policy activities, promoting information sharing through annual consensus conferences, developing evidence-based tools and resources to support adoption and implementation of obesity prevention policies. And all of these tools and resources that we've developed are housed on our website called www.powerupforhealth.ca, which we're hoping will be a one-stop shop for policy tools and resources to promote policies around obesity prevention. So the slide now just shows a picture of the main page of our website, www.powerupforhealth.ca. And as you can see, the Policy Readiness Tool is part of the PowerUp project and is available on our website. What I wanted to highlight today is how many of the tools and resources available on the PowerUp website can be used along with the Policy Readiness Tool to facilitate policy around obesity prevention. For example, using the Policy Readiness Tool, we know that for innovators, a key strategy is to provide supportive evidence. Along these lines, we've put together a variety of evidence syntheses on our website on topics like taxing sugar-sweetened beverages, healthy food procurement, economic incentives, school food policies, and school physical activity policies. And we have a couple more evidence syntheses on their way. Further, for majority, we know that a key strategy is outlining public opinion, and so considering this, our website has information on how to access findings from our knowledge, attitudes, and belief surveys, which explore public and decision-maker support for physical activity, nutrition, and obesity policies. And last, we know that for late adopters, one strategy is to illustrate how communities or organizations with similar characteristics have adopted and implemented policy. So showing how other communities have had successes with the proposed policy. And along these lines, we're in the process of collecting policy stories to understand experiences, successes, and challenges related to the adoption and implementation of public policies for obesity prevention, so that lessons can be applied to other jurisdictions across Canada. And then one more thing to stay tuned for. In the near future, we'll also be publishing resources illustrating how policies like daily physical activity policies spread from one place to another, which can also be useful for late adopters in terms of illustrating examples of how other jurisdictions have been successful with policy change. And so that's all for me. I hope I've provided some examples of how the Policy Readiness Tool can be used alongside other tools and resources as kind of one tool in your policy toolkit. To learn more about Alberta Food Matters and their efforts to promote a universal school food strategy, you can visit the Alberta Food Matters website. To learn more about PowerUp4Health.ca, I've provided the link on the slide, and you can also subscribe to the PowerUp e-newsletter.
Okay, so it's back to me. It's Candice again. We do have a few slides left in this deck, but I think what I'm going to do, in order that we have enough time for questions, I'm going to move through these pretty quickly, particularly because we've been through them before in part one of the webinar. So just at a very high level, we know that successful policy diffusion, or the spread of policy from place to place, really depends on the interaction between groups over time, and that we do critical mass of policy at one level can lead to a higher level of policy in a different jurisdiction. We know that diffusion to help diffusion along, it's important to support action and advocacy, and that understanding trends in adoption is useful for refining strategies and responding to changes in policy context. When we're applying the tool, real strength of this tool is that it helps to build both sort of personal and professional capacity, as well as community and organizational level capacity for policy change. It helps to address the resource capacity of advocates and organizations working in policy development, because it really allows you to strategically, can you guys please use your phone? Thank you. It allows you to really target your resources strategically, and it allows you to build through intersectoral collaboration.
Hi, sorry everyone, it's Jenny from NCCMT. Just a reminder to everyone that if you've joined today's webinar via teleconference, to please mute your telephones to avoid distraction for our presenters today.
And just to thank you, Jen. Just to look at limitations, it's important to know that when we're thinking about diffusion from a theoretical perspective, it's examined in one direction over a specific time period, and that it's seen as a very linear process. And we all know that this does not apply to policy. Policy is a very circular, convoluted process. It's dynamic. It changes. And that's why it's important to revisit this readiness issue over time. Diffusion is most applicable in simple and single issue cases of policy change. It's not that it's not applicable in complex situations, but it just requires appreciation of more nuances. The most important thing is, regardless of stage of readiness, users of the tool must remain flexible and leave room for acting on the unexpected and taking advantage of policy windows. So what's happening now with the Policy Readiness Tool itself is that we are undergoing an evaluation of both the tool, both the tool and its strategies. So if you are on the website and you do use the tool, if you have time, please take part in the survey. We will be doing follow-up interviews with those who are interested to hear more about your experiences and what works or doesn't work. And as Shandy mentioned, we are working to adopt the tool in other settings, and we're also always connecting with people interested in healthy public policy change. So if that's you, please do feel free to contact any of us that have spoken today. And if you want to join the conversation more broadly, I encourage you to join the PRT community online. And I just would like to acknowledge all of the various sources of funding for this program of research. It's been in place since 2004, and we continue to get support, which I am utterly grateful for. And I think at this point, I'll just show you our homepage once again, and I'll show you our homepage once again. This is what it looks like. Please check it out. And then if you'd like to get a hold of any of those of us you've heard today, here's all of our information on screen. And I think I'd like to stop talking now and open the floor for questions. And Jennifer, I'm assuming you're going to moderate that again, right?
Yes, hi everyone, it's Jenny at NCCMT. So we are just going to ask you one final polling question about what your next steps are after today. So as we're engaging in a Q&A with Candice and the rest of the presenters, you can go ahead and let us know what your plans are after today. So we will now start a period where we can ask questions of our presenters today. So there are two options for doing so. One is you can unmute your telephone and ask the question of the presenters yourself if you've joined via teleconference, or if you've only joined via online, you can post your questions in the Q&A, and we will have them asked of our presenters today. So we actually have a question that's been posted in the Q&A. So those of you are either on the phone or online thinking about your questions, the one question from Jenna Dixon is, how did some of the policy developers find the funding to do these initiatives? I'm not sure which of our presenters today would like to address that, but one of you, please feel free to go ahead and respond.
Sure. Well, it's Cathy Gladwin at the Injury Prevention Center, and it's part of the mandate of the center. So I was paid through my work in the center. So that was fairly simple.
And it's Shandy Reid here. So when I was with the Policy Coalition, we were a unique group in the sense that there was 15 provincial organizations at that time who came together during the period which I was employed there. And although we did start out with a community grant, as you would know, a lot of the times if you receive funding from government or others, there are restrictions in terms of the role of advocacy. So we were able to successfully receive support from some of our 15 organizations who were able to provide that kind of funding, and so that we are very careful to make sure that the dollars or the resources being used for the advocacy part were kept separate from our funded projects. But that is, it doesn't take much. I will say that sometimes complexity breeds despair, but it's actually amazing how much can be done with very little budget. At any given time, I may have had under $5,000 for an entire year of operational budget, and because you're engaging others and you're really drawing on people's human resources and their commitment and time, soft costs, I guess you'll say, if you're able to get organizations to provide people who believe in that, it's quite amazing what you can accomplish.
Great, thank you. So we just wondering if anyone that's joined via the teleconference has any questions for our presenters. If you do, you can unmute your telephone and ask it of the presenters. We do have, while we're reading to see if anyone via the teleconference has any questions for our presenters, we have a question for Cathy from Wei Mei Wong. Did stakeholder interviews help increase interest in implementing policy?
The stakeholder interviews were key in finding out who it was within each municipality who had driven the process and who had actually drafted the bylaws and what sort of information that they were using. So I was looking at what bylaws had already been done and who was driving them to then take that information and contact people with similar roles in the municipalities who had not yet developed any policy. So yeah, that's been really helpful. And now, you know, talking to municipalities who haven't done it yet, I know who to talk to and what issues they might have questions about, and then I can go back and you know, find out. You know, there's often with this issue the question about enforcement. So if I can hook up the person who knows that, you know, putting the bylaw in place is way more important to changing the behaviors than actually doing on-the-ground enforcement, then that sort of covers that, or takes the municipality over that hurdle and makes them think that they can actually implement the bylaw for themselves.
Thank you so much, Cathy. I'm waiting to see if there's any more questions being posted in our Q&A. At the moment, are there any questions from those of you who have joined via teleconference that would like to unmute your telephone and ask it of our presenters today? Okay, we'll give people a bit more time if they'd like for that. We have had another question come in via the Q&A, and the question is, when using the PRT, is this a group activity led by a single person? How to start the conversation around initiation and defining who you will assess?
Okay, this is Candice. So when you go to use the PRT tool, it can be used by a single person sitting at their desk. It can also be used as a group activity, as the person is asking. And the way that you would go about doing that is twofold. One, you can, you know, have a very sort of particular issue and a particular target in mind, and then go through and with each of the 11 questions sort of have a conversation about, well, what do we think best fits our issue and our target, and pick that. Or you can use the tool itself as a way to begin to figure out really what is it the issue you're going for and who should the target be. So really when you're looking at each level, you wouldn't go towards using the PRT very generically, like, I want to work with the City of Edmonton on healthy public policy. It would be a little bit too general in order to really use the tool effectively. But if you know that your interest is in helmet bylaws, for example, and that you really want to start at a city level, then you would think of the city that you want to start of, and you would think of that issue, and then you would go through having a conversation with your group around how each of the 11 questions apply. Defining who you would assess is a little bit separate from using the tool itself. It's really about what kind of solution are you looking for? And who are you working with? So if you're, I'm going to sort of pick on Kayla for a little bit. If you're working in the arena of food and you think that you want to look at food with children, then you're really probably going to identify schools as an appropriate target because that's where most children are, and you think about school policy. And then you'd have to make a decision about whether you're targeting an individual school or a school board or a school district, and then you would fill out the PRT accordingly. But in contrast, if you're working in the area that I worked in, which was really around tobacco control and smoking bylaws, the most appropriate place to start there is typically the municipality because they can really set the tone for change both above and below them. And by above, I mean sort of at the provincial level, and below, I mean in organizational workplaces and such. So it really, that decision about where to start has to happen internally, and then from there, the PRT is very flexible. I think I'll stop there because I see more questions popping up.
Okay. Thank you so much, Candice. Staying with the topic of the PRT, an attendee, Lena Hassan, has asked, am I correct in assuming that you were supposed to fill out the PRT for an organization? I thought I heard one of the presenters today say that they sent the PRT to rec centers to fill out themselves, so if you could clarify that.
So this is Candice. I will jump in, and then I'll also ask Sherry to jump in. And I just want to make note that Cathy has seen Jenna Dixon's question and has an answer for her as well. So you are correct, Lena, in assuming that you are supposed to fill out the PRT either for an organization or for a municipality, but you are also correct in that the PRT can be sent to an organization itself to fill out, and we have had experience with users who have used it on behalf of their own organization to do internal strategic planning as well. So both, in terms of clarification, both options are correct and viable. I don't know, Sherry, if you want to add anything.
Yeah, no, just that we did send it out to rec centers to complete, and we just did that just because we felt that that was the best way to be able to group people into the categories so that we could ask targeted questions of them to help gather very specific data. So yes, we did ask the rec centers to complete it on their own, and we use their responses to group them into categories.
Okay, regarding Jenna's question about have there been any barriers due to changes in government leadership in an agency for policy development, and I have one other example from our Injury Prevention Center work. A few years ago, we had heard about a municipality in Alberta, Wetaskiwin, had put in some bylaws to help reduce problems that they were seeing around alcohol use. So they put in a bylaw that restricted the hours of alcohol outlets, and it also reduced. The bylaw also covered restrictions on the hours that pawn shops could work. So they had this in place, and they found that there was a significant decrease in the number of drinking and driving collisions in the county when they reduced the hours of the liquor stores. So then the neighboring county, Ponoka, noticed that their injuries and problems with alcohol, had gone up a bit. So then Ponoka, the council that was in Ponoka at the time, adopted similar bylaws to Wetaskiwin, and while they had seen a decrease in that problem, the council that was voted in at the next election, they were more interested in maintaining the hours of the liquor stores, and so they repealed the bylaw right away. So that can happen.
And this is Shandy. I guess I'm speaking from a provincial perspective. I mean, one of the things that happens, of course, even in Alberta where we had the same government party for many, many years, up until recently, every time there's a cabinet shuffle or a change in appointment, you really are starting, not necessarily starting over, although sometimes it can feel like that, where you're spending a lot of time making sure that government officials, who you should work closely with and develop good relationships with where possible, are tasked with briefing up and making sure that the new ministers are well aware of the issues. So by developing relationships with government officials that are trustworthy and being able to share some of the information when it's useful to them to include in those kinds of briefings is really, really important. So developing relationships and establishing yourself as a credible resource and providing that evidence and getting it in the hands of folks who need it is really, really a critical piece of the policy development during times of change.
Great, thank you all. So it is Jenny again here at NCCMT, and we've had a few more questions come in. One question from Brian Malnick is, does the PRT promote directly to the use of most up-to-date and accurate evidence on effective interventions around a public health issue?
I don't know if I understand the question correctly, so if I don't, Brian, please send in another note. But what it does do in the strategies that are targeted to each level of readiness, it talks about how to use evidence appropriately for those levels of readiness and about how to frame messages from the evidence. And so, yes, we always point users to using the most up-to-date best practice information that's available. That being said, the PRT itself does not provide that best practice information because it really is issue and intervention specific, and we really don't have the capacity to be doing that across issues.
And I think my example of PowerUp was how we're using the PRT within a bundle of other resources specifically around the issue of obesity prevention. And so within our PowerUp project, we are synthesizing evidence around obesity prevention policies.
And it's Shandy, and I'll just add to that in saying that when presenting some councils on different municipal issues in the past, one of the things that I was mindful of is that depending on the innovator or the majority, they're going to see they're going to have different tolerance levels for how much evidence they require. And so some will require very little. They'll need to know, generally speaking, this appears to be a good idea, that there's reasonable evidence to suspect it will produce a certain outcome. But they're prepared to take that risk, assuming that they've got enough support or enough motivation, and maybe it is because other jurisdictions are lobbying to do a similar action. But those are different folks from others, perhaps a little further down the continuum in some of that, C category, for example, where they were going to require a lot of long and well-established research and evidence to show them that the risk level is reasonably low and that they're pretty much guaranteed a certain outcome. So the use of evidence and the kinds of evidence and the rigor at which you use it is going to vary depending on the group that you're working with.
Great, thank you. Is there anyone, we do have another question that's come through online, but just wondering if anyone, this is Jenny again at NCCMT, if anyone that is joined by a teleconference would care to unmute themselves and ask a question of the presenters directly. We'll leave that open for a moment for you to consider. Okay, since no one has unmuted themselves just yet, we do have another question from Tanya Stoll, and the question is that the questionnaire does not seem to include questions. There are a series of statements. How do you phrase the questions to the respondents?
Okay, so maybe questions was a misspeak on my part. They are actually framed as statements, and really you're just, it's like a level of agreement. So it would be similar to reading out a Likert scale type of statement where you say the statement or the set of 3 statements, and you choose the one that fits most closely to your situation. So it's not really a question, more as indicating level of agreement with one of 3 slightly different scenarios that matches you most closely.
Great, thank you. And Tanya did have another question, which is, will the evaluation that's being conducted include reliability and validity testing of the tool?
The short answer is yes. The tool, so we are looking at reliability and validity more robustly, but the tool has been used a number of times in many situations, and we have established face validity since the first implementation of the tool. So if Tanya, if you want to email me a little directly, we can have I can give you that information in more detail.
Great, thank you, Candice. And before we begin to wrap up this afternoon, just wondering again if anyone who's joined by the teleconference would care to unmute themselves and ask a question of the presenters directly. Okay, so I can pause again in another moment just in case there is someone out there. So your feedback is quite important to us here at the National Collaborating Center for Methods and Tools. A short time ago, we posted a link to a survey that's available. So a very short survey, but we'd ask if you have a moment to please let us know what you thought of today's webinar, as it's very helpful for us in planning future webinars within and outside of our Spotlight on Methods and Tools series. And after today, the resources associated with the webinar will be made available online. So the PowerPoint presentation in both English and French is available at our SlideShare web address, which is listed there. And the audio recording only in English will be available on our YouTube channel, And just wondering if anyone has any other questions. Again, I'll pause to see if anyone via teleconference would like to ask a question of our presenters directly. And just to let you know that we will be continuing this series, and we do have, right now we're planning for one webinar a month within this Spotlight series, but we'll also be adding a new series of webinars as well here at NCCMT, but I will have our next webinar in just over a month's time on a consolidated framework for implementation research. So learning about adapting public health interventions for implementation across settings. So you can register, and we'll post that link in a moment. You can register for our webinars at our WebEx address. So if no one has any further questions or comments, we can certainly say goodbye this afternoon. I thank you, Candice, and all the presenters on behalf of the National Collaborating Centers, and we're having many attendees today saying thank you very much for today's webinar, and I will just leave it to any of the presenters if they have any final thoughts or would like to leave our attendees today with any, golden nugget of information.
I think on behalf of all of us, we just want to say thank you so much for giving us time in what I imagine is your very, very busy schedule. And of course, please feel free to email any of us if you have any questions or would like further conversation. I know that we're all available.
Great, thank you so much, Candice, and thank you